I'm here today with Nicola, and she's going to talk a little bit about preparing your body for having baby, going through pregnancy, labor, and those kind of things. So, hi Nicola.
Hi.
So if I just use my own self as an example,
Yep.
At this point I'm not pregnant.
Okay.
But if I were to get pregnant,
Yep.
What could I do to get ready before conception?
So, an ideal situation is we see you before you pull the goalie, so to speak. And what we're doing at that point is getting a baseline. We're working out if there's any problems. So, if you have any incontinence, any problems with sex, any problems with urgency, because a lot of people, the assumption is that their pelvic floor is weak if they're leaking, and quite a lot of the time there's a tension issue. We also want to make sure that you're fairly aligned and that your body's in a good physical state to have a baby, because having a baby is in fact a sporting event.
I can do sports.
It's like a 9-month marathon, and then at the end you have several hours and sometimes days of work to do.
So basically I've run 2 marathons in my life.
Yes,
I'm going to count that.
you should. You
Okay.
should definitely.
All right. All right, so baby's conceived.
Yep.
Now what?
So we don't. I normally recommend you wait till you're past the first trimester. As with most things in the medical world, we just don't touch anything for those first 12, 14 weeks. And then at that point, we would kind of do another reassessment. Check how the pelvic floor is doing, check your ab strength, check your hip strength, and then start working on getting you ready for the labour and delivery part. We're also trying to prevent things like perineal tears or minimise the chances of getting them. Second degree tear will result in an 80% chance of painful sex. A third or fourth degree tear will result in a 270% increased risk of having painful sex afterwards.
That's not nice.
No, and that can last for 2 years or more.
Oh dear God.
We do see patients who never had pain-free sex. Also, if there's any leaking starts, so a lot of people think when they're pregnant they should leak. Yes, your bladder is compressed as baby grows. Your bladder goes from having good expansibility to smaller and smaller. And, we've both been pregnant. You can't walk past a bathroom without thinking, oh, I should go.
Just in case.
But leaking isn't normal when you're pregnant. It's not normal at any point in your life. So we want to make sure that doesn't happen, and we're trying to address it as we go through the process. Also maintaining the integrity of your abdominal muscles. So it's out there, it's widely known, diastasis recti, which is a separation of the rectus abdominal muscles, and they become stretched rather than separated, and we see it 100% of the time. But what we want to make sure is that you know how to contract your core, how to work your core gently. You're not going to squish the baby, and that will help your recovery on the other side. Also, lots of women will end up with pelvic girdle pain, which is pelvic pain, groin pain, pressure in the pubic symphysis area during pregnancy, and we have great techniques that can prevent that from happening.
It's amazing.
Yeah, it's pretty cool.
So this will probably require a little bit of exercise and effort on my part?
Yes. Not lots. The new guidelines tell us that as a pregnant woman, 150 minutes of exercise a week is great. In fact, we actively encourage you staying active during your pregnancy unless you are told not to. The same way we actively encourage you to maintain a sexual relationship with your partner, again, unless you're advised not to. And that would be by a doctor or midwife, not by me.
Yeah.
So, as a general rule, the fitter we keep during our pregnancy. That doesn't mean you start CrossFit in your first trimester, or your second, or your third. If you've never done CrossFit before, you don't start it when you're pregnant.
I'm already in the middle of a marathon. I don't need to start another one.
Exactly. But, even if you've been doing yoga, get in some prenatal yoga classes, and we have some great resources in the Belleville community of sports personal trainers who specialise in treating and working with women who are pregnant.
Yeah.
So I would recommend those people, and I'm sure they'll be on the webpage.
Yeah, we'll have some videos with them as well.
Yeah.
Okay, so I've had 2 kids before.
Yep.
I've gone through labor.
Yep.
It wasn't pleasant. it wasn't traumatizing. But if I went through a full program and actually made sure to ready my body for this, could I hope, no guarantees,
Nope.
but could I hope that the next labor with the next baby, if I go through everything, could be better?
Yes. So we do know that having good pelvic floor strength can reduce your time of labour by about 20 minutes, which doesn't sound a long time, but if you've ever been in labour, 20 minutes can feel like 3 days. We also know that doing things like perineal massage during pregnancy, it's not effective actually while you're in labour. It's only effective prior to, but it can reduce your risk of tearing. Again, we can't guarantee anything. The same way you can't go to an obstetrician or a midwife and guarantee you're going to have a home delivery or a water birth or no C-section. It doesn't, unfortunately, work like that because there's another person involved in that decision process.
Babies break all the rules.
Yeah, that's exactly it. But as a general rule, we can prevent all these things. We can make sure that you're well educated for your worst case scenario as well. The words pelvic organ prolapse freak everyone out. Anyone Googles it and they hit Google Images, you're going to be very, very terrified of what can happen to your body. But it happens during pregnancy. That the pelvic organs start to fall or droop into the vaginal cavity. And again, we can work to, there's research coming out now that says pelvic floor physiotherapy can actually get rid of it or improve it. And I've had that experience personally where I went from a grade 3 to a grade 1 with pelvic floor physio. So there's lots we can do. It doesn't necessarily mean seeing me every single day during your pregnancy or even every week. It depends on what your symptomology is.
What if I want to see you every day during my pregnancy?
You can come see me every day during your pregnancy.
Yay!
As long as you bring me candy.
Okay, that's fine. We'll share.
Okay.
Okay, last part. After baby.
Yep.
Baby's born. How soon should I be wanting to come see you again?
After your 6-week check.
Okay.
So I normally tell any of my pregnant ladies, when's your baby due? Let's add a week and add 6. And then I book that appointment so they have that appointment.
Yeah.
Because what happens is people get absorbed with baby and forget to leave the house. And then I see them 8 months, 8 years, 15 years post. Because once you're postpartum, you're always postpartum. It's, it's true, right? And the longer you leave something, the harder it is to improve. And what we're looking at that point is how separated are your abdominal muscles. If at all, do you need to be wearing a wrap? Do you need to be doing some ab work? Do you have pain? Do you have tears that we need to work on scar tissue? Did you have a C-section that you need to start addressing the scar tissue of that? The sooner we address all this, the quicker your body will recover, as a general rule. And then also getting you back to whatever it is you need to get back to enjoy your life, aside from being mum. Because we kind of forget before we were mum, we were someone else.
Oh.
And we also need to remember that person.
That was a thing?
Yeah, that was a thing.
Okay. Any last comments, thoughts?
No, I think that pretty much covers it. If anyone has questions, they can contact me through my website.
Yeah. So, Nicola with Diamond Physio.
That's it.
We'll put up a little link under the video for her website, so you can always reach out if you have any other questions. And with all of our videos, if there's something that we touched on that you want to know more, let us know. Send us a message with the website, Facebook, anything like that. But otherwise, I think that's it for now. So, thanks for tuning in. Thanks for being here.
Bye.
Bye.